Great. Good morning, everyone. So here we are. It is almost the end of September, and we'll go through. I don't think we have a presenter today, but we'll go through. Everybody can introduce themselves, talk about what events you've got going on. Tomorrow is Save a Life Day, so if you're working with an event for that, please let me know how that is going. I will wait till the end and tell you what the big news with Reach and what we've been doing. But Jen, if you want to start off, introduce yourself and anything you've got going on, and then send it over to somebody else.
Sounds good. My name is Jen. I am the outreach coordinator for Northwood Health Systems Crisis Unit, which we are located here in the Northern Panhandle, here in Brooke County and also in Ohio County. We have 16 beds at each facility, and we can assist with withdrawal symptoms, detox, and psychiatric symptoms. I am working Save a Life Day tomorrow in Marshall County at the Moundsville Pharmacy. So I will be there. Other than that, there's not too many events. I am going to an event next week at Wheeling University. They're having a health fair. So I will be there next week. I am actually working today at 11 at one of our high rises here in Wheeling. So I will have to hop off if we're still having the meeting. But other than that, that's all I have going on. And I'll pass it to Ashley.
Hi, everyone. I am Ashley Lowe. I'm the reentry coordinator with the U.S. Attorney's Office. We handle the 32 northern counties. Only update I have, we just had the probation officer reentry simulation last week. It went really, really well. We probably had about 40 to 50 people that came through it. Very positive feedback. So we're looking forward to doing that possibly every year. Still working on the resource manual for the state, but that's all I got. I will pass it off to Nikki.
Good morning. My name is Nikki Potts, and I am with Pyramid Healthcare. We have locations in Kearneysville, West Virginia, also opening a facility in Hedgesville, West Virginia. We are a residential and detox program. Currently, we have 8 male detox beds. We also have residential for both male and female clients. Total of 80 beds here in our Kearneysville location. Hedgesville will be opening hopefully come mid to late October. And we do have an open house on October the 10th and a ribbon cutting at our Hedgesville location. I can actually share the flyer in the chat. And I will pass it off to Kaylee.
Good morning, guys. I'm Kaylee. Can you hear me okay? Because I was with things. Okay. I'm with the Division of Rehabilitation Services in Weirton. We are in the state building. What we do is we help individuals with disabilities meet their employment goals. So that can be somebody, a freshman in high school, all the way up until senior citizens age if they're wanting to work. We can help with some college expenses, resumes, interview skills, short-term on-the-job training, all that kind of stuff. I didn't put our website in there, but I will put our website in there. So there's more information about everything that we do, as well as people can send in referrals on our website, and also ask questions, and it'll get to the specific offices that it needs to go to. So with that, I will pass it on to Philip.
Good morning. I'm with a new federal grant called PROUD, and we are only a few months old, and we're partners for reentry opportunities and workforce development. I'm with West Virginia Workforce, and we are going to be hopefully going into some halfway houses to help individuals to find good paying positions here in the workforce community. I represent the southern part of the state. My colleague that's in the northern part of the state is in a meeting and couldn't make it, so I'm here. His name is Wesley Hoffman, and Ms. Spears just put our information there in the chat if you want to learn more about PROUD, and we're always willing and able to help, and hopefully that there's some individuals that can help us so we can get these individuals employed. And I appreciate you allowing me to be on the call. Thank you. And I'm not sure who has not gone. Miss
I think,
Helpsel? Miss Helpsel?
yeah, I think Rihanna, I think you're last. Rihanna?
Hello, can you hear me? Okay, I've been having issues with my laptop today. I couldn't hear the first half of the meeting. I'm presenting today, correct? Or am I just
Okay, sorry about that. I will give you host control here in just a second.
okay? I
Maybe
mean,
I
if you had
can-
something else, that's totally fine. I
No,
have
no.
it on my calendar that I was okay.
Yep, you're good. One last thing is, Nikki, I could not open that flyer. It says it's a security risk. Can you try to email that to me?
Yes, ma'am, absolutely.
Alrighty, thank you. All right, sorry, Rihanna, you have control. You are co-host now.
Okay, awesome. Let's see here. Okay, so I just have our website up right now. If you're not familiar with, well, I'll introduce myself first. I'm getting a little ahead of myself. My name is Rihanna Heltzel. I work with Unicare. And if you're not familiar with Unicare, it's one of 4 options of Medicaid in the state of West Virginia. So how you would enroll, which I'm sure all of you guys are very familiar with how Medicaid works and stuff. But if you go in, you don't have insurance, and you meet the state income guidelines, you can go in and apply. You can do that online, by phone, or in person. And after you apply, you'll check your mail, and then they'll send you a notice to let you know if you're eligible or not. And then from there, you'll be able to pick which health plan you want out of the 4 options, and Unicare is one of those options. We here at Unicare do Medicaid and West Virginia CHIP as our op. And then on here, you can see if you qualify. So who's eligible? Anyone who gets SSI, pregnant women, children under 19, adults 19 to 64. The 64 is the cutoff because that's where it moves over to Medicare. And then the West Virginia CHIP, you live in West Virginia, you're not eligible for Medicaid, you're a U.S. citizen or qualified immigrant, and you meet West Virginia CHIP income guidelines. Okay. Also, one thing that I like to just highlight is the renewal process that started up this year, which I'm sure you guys heard a lot about. We were going crazy and talking all about it. But during COVID, they put a pause on the renewal because they wanted everybody to be able to keep insurance because of how crazy life was and stuff. Now, since COVID's kind of died down a little bit, which it hasn't, it's like I feel like COVID's even like COVID numbers are up now, but the renewal process is now starting back up. So that means they'll have to go in and prove that they still meet the income guidelines to keep the insurance and stuff. So that might be something you might get is someone that says they went to the doctor or they went to go pick up their prescription and the pharmacist told them that they no longer had insurance. It may just be that they missed the renewal mail that they got from DOHS because it is just in like a little white envelope. Sometimes they just throw it away or they moved, didn't update their address. Just let them know like, hey, maybe it's just as simple as going in and just renewing. But if they don't meet the income guidelines, that's where they will lose the insurance. But there is the West Virginia Navigators to help out with that. So they can switch at any time. So say they pick Unicare and we upset them for some reason or we don't cover their provider in the area. they are able to go in and switch every 30 days. So if I switched now, I would have to wait for 30 days and then I would be on my new plan for whatever I picked. And then I say something happens, that one doesn't work out. I can wait 30 days and then switch again with whatever works best for me. Okay. So every Medicaid plan has benefits. Here at Unicare, we have the 24-hour nursing line. There's the dental care, which every Medicaid plan has the same, which is the $2,000 every 2 years that they can use for dentures or whatever it might be that like cleanings. Well, we cover the cleanings, the x-rays, and the fillings, but if they need anything outside of that, that $2,000 is used for that. And then we have the healthy rewards. We reward our members for doing preventative care. So if they're going to the doctor and they're doing breast cancer screenings, that's a $50 gift card that we'll give them. Childhood dental visits, that's $25. The wellness visits is $25, and those are good gift cards too. They're like Sephora, Ulta, Subway, AutoZone, Lowe's. And they're digital gift cards, so they will have to have like an email address, and then we'll just send them the digital gift card through the email address once they've received the care. And then we have our value-added benefits, and there's a long list of them, but the ones that I like to highlight are we do Weight Watchers and gym memberships. We do youth club memberships, personal hygiene boxes. We do the $100 gas card for members. So that's $25 every 3 months per household to help members with transportation. So that's only one per household, but $25 every 3 months is helpful. We just added the NAMI membership for members hospitalized for emotional and mental health conditions. So that's per household. We do an employment support package for eligible members. And then we also added the filtered water pitchers for eligible members because here in West Virginia, there are a couple counties that have a high number of lead in the water. So we want to make sure that they have a water pitcher to lower that risk, which you can get lead poisoning from other things, but in the water. And that would be Harrison, Mineral, and McDowell County qualify for the water pitchers. We also have the pregnant members value-added benefits. This has changed a little bit. Originally, we would send you like bottles, diapers, stroller. Now what we're doing is we're just giving you a $170 gift card after you complete your 6 prenatal visits, and you can use that towards any purchase of baby items. And there's like over like 500 stores that will take this gift card, and the big ones were like Target and Walmart. Like, so those are the big ones that West Virginia has that it's covered by the gift card. We also allow our pregnant members to do 2 dental visits per pregnancy and childbirth classes to help you. Great. And then the last part is what I do here at Unicare, which is I work for the population health team. So what we do is we help our members get connected to resources in the area. So we have navigators who, once a member is identified having a need, they'll give them a call and they'll go how's housing, how's employment, how's utilities, and then we'll get them connected to those resources in the area. What I do because we focus on the social determinants of health, their medical barriers, non-medical factors in one's living and working conditions. So, did you have a playground when you were growing up? How was your diet growing up? Did you experience homelessness? How was your relationship with your family? And we focus on those. and education is a barrier. So as a health promotion consultant, I go out and I promote healthy habits within the community. So I am certified in the Catch My Breath. I offer a diabetes class in the community for free. So if we could just like educate them on certain habits that might prevent them from being sick later on in life, that's what we try to do. And we use the community resource link here. So I'm able to type in my zip code and search, and I can pull up all of the areas, all the resources in my area. So if I need a food pantry, I can click the food pantry and I can see the closest food pantry to me. And from there, say if I'm helping somebody, I can share it and I can just send it as a text to somebody. I'll just let them know my name and the text and the language. It'll convert to Spanish and then I just send them a text. So that's what we use, which is Find Help, which I'm sure all of you guys are very familiar with. And then I think that's it. We also have a newsletter that we send out once a month. So if you're interested in getting added to that newsletter, just let me know and I'll send that out. Are there any questions or anything? Right, well, thank you for listening to me today.
All right, thanks, Brianna. I appreciate that. If you have any flyers or anything you want me to share out, just email them to me or drop them over here in the chat. All right. See. Anyone have anything else that's going on? Anything on your mind? No? All right. Well, I will share with you, maybe if I can find it, when you have too many open tabs. So we were awarded last Thursday the $481,000 Appalachian Regional Commission Inspire Grant. So the Reach is got a new program, but not a new program. So we have our Reach Back Reentry Navigators, and this program will allow us to hire 3 more of them. So they will become paid positions and not just volunteer positions. Those of you that know our navigators and what all they do, we know that support that they provide, and eliminating the barriers, of IDs and employment and soft skills training and housing and all of those things are hard to navigate. So, this program will allow us to hire 3 of those navigators, and we'll track everything for the next 2 years, and hopefully to show the worth and the positivity of it so that we can, hopefully make it a paid position for everyone. But we're pretty excited about that. I mean, I'll drop the link over so you can read this yourself, but it is a very lengthy application process to apply for these. There were, I think, 5 or 6 awarded in West Virginia. So we were very, very excited to have one of those awarded. So anybody have any questions about that? All right, let me I dropped that over in the chat if anybody wants to read that later, but I guess that's all we have this month then. So I appreciate your time. So if anybody has anything else, speak up. Otherwise, I'll see you next month.
See you next month, or I'll see you soon.
Or see you tomorrow, or see you. Yeah, I probably should check with people tomorrow to see if they're going to host their councils or not, since tomorrow's a busy day. So, all right. Thanks, everyone.
Have a good day.
You too. Bye.